Oh my gosh, I always say where there is a will, there is a way. So I am glad to be here. Hopefully we're on all our we're back on Instagram. We've had so many people who really wanted to hear from you and talk about this issue. And there were a couple of key questions that came up, especially in regards to bladder health. And that was the first one was on prolapse. So
Yes.
let's talk about prolapse a little bit.
Yes, the ultimate, it's fallen and can't get back up, right? So, yeah. So a lot of people ask, unfortunately, what is prolapse? So 50% of women will experience a prolapse at some point in their lives. So it is definitely something we need to talk about because when I was practicing urogynecology in the office, I inevitably would have women that would come in and be like, I'm the only person that this is happening to, right? And I'm like, no, I have a whole schedule filled with people that think that they're the only ones that this is happening to because we just don't talk about it. So the way the pelvic floor, well, we have our pelvic floor muscles that hold things in place, but then there's ligaments between the bladder and the vagina and the rectum, and basically it's holding in the uterus and it's holding everything in place. And so, unfortunately, because of things like childbirth, lifting heavy objects, bearing down out bowel movements, over time, those ligaments can get stretched or damaged. And so now the bladder can lean on the vagina and push it out, or the rectum can lean on the vagina and push it out. And so we have those issues where it's prolapse is just that this drooping and dropping of the pelvic organs because we're basically an open hole to gravity because there's not much other than muscles and some ligaments holding everything in. So it's very, very common. So what else would you like to know about
Oh,
prolapse?
oh my gosh, I know. And then like before, I mean, we're both surgeons, right? So before repairing prolapse, you want to
Mm.
increase the hormones to the pelvic floor. So Jolva, of course, vaginal testosterone combined with DHEA, even with progesterone and or estrogen suppositories to be to the vaginal floor can help increase the strength of the muscle, increase the integrity of the tissue if we do have to operate. But that's where I found out that the more I did that, whether it was for incontinence or pelvic pressure symptoms, prolapse issues, you know, all of those issues, as you worked hormonally, they'd come in for their pre-op and say, Dr. Ann, I'm not having those symptoms anymore. Have you had the same experience, Betsy?
Yeah, and I think that's a good point because, so many of us put things off, when it comes to our own health, so that by the time we do get to the doctor, we want it all fixed yesterday. But really, prepping that tissue is going to help you heal better, but it also may actually help to reverse it to a certain point. It's not going to fix the ligaments that are broken, but it can kind of reverse some of the symptoms of the prolapse to the point where maybe you don't necessarily need surgery. So you definitely want to be using, products like Jolva to help prepare that tissue and get it in its best, in best situation. So if you then have to proceed with surgery, and you want to give it a good 3 to 4 months use before you even considering, having surgery.
I
So
agree. I agree. And that as a surgeon too, you want the best outcome for our patients. So,
yeah, and also, strengthening that pelvic floor. Like all of us start to lose muscle mass in our 30s. We start losing 8% every decade, starting in our 30s. And so we don't often think about our pelvic floor muscles and strength until all of a sudden we're having symptoms. So even just doing Kegels or pelvic floor strengthening can reverse the appearance of the prolapse to the point where maybe you don't need surgery. And that's something I figured out when I first came out of training, I was trained as a surgeon. So everybody that walked through the door, I was thinking surgery. But as I matured through my career, I realized if it's not bothering you and it's not causing any medical conditions, you don't necessarily need surgery for a prolapse. So that's something that, if you're being sent to a doctor to look at this because maybe they just found it on your exam, the first thing I would talk talk to your doctors and be like, well, do I need surgery? Ask them, like, what is it? What would happen if I don't do surgery? What are the risks if I do surgery? And, what am I expecting things to be like? Because I've had some people who've lived perfectly normal, fulfilled lives without having the surgery. And then some people, the surgery is, if it bothers you so much emotionally or mentally or physically to the point where it's affecting your quality of life, that's a good time to have the surgery.
Yeah, no, absolutely. And I think that's the maturity of, and what we're seeing too, speaking in the menopause space, here we are on World Menopause Day, is that because more female physicians have come through menopause than ever before in history. I mean, when I was in medical school, there were 15 women in a class of 115 students. So
Wow.
15 women, 100 men back then in 1991. And so, and in residency for OBGYN, when I started residency at Emory University in 1995, there were 4 women and 6 men. And so like that, but that has shifted. That has shifted over time. I was curious about you too. And in urogynecology, how many fellow urogynecology fellows did you have?
Oh gosh. I mean, urogynecology is a pretty new field. So even then, our program was pretty new, and it was mostly men that were going through the program and after me, there was a couple women, but really, even when I was there was only one other urogynecologist fellow that was going through. And I mean, if you look at across the United States, there's only 1,500 urogynecologists in the United States. Yeah. And there's such a need. If 50% of women are going to have a prolapse at some point in their time in their life, and like
85% experience incontinence over age 65. Yep.
Yeah.
So we need more women urogynecologists, Betsy. But also there are amazing men. I'm not in any way dissing male physicians. I've had the honor and privilege to work with many of the best, most human, lovely people. And but to say that as a physician, when you're taught something and it doesn't work on you as a woman going through menopause or early menopause or infertility, you have a whole nother perspective. And that's one of the reasons we're teaching things here. Amy Hernandez asks, she says, I'm new to perimenopause and I have a family history of breast cancer and cervical cancer. I'm afraid to start any products or replacement hormone treatments because of my family history. I hear you. And that can be scary. Betsy, you want to take this?
Yeah. So you know what? It's so interesting because I too, when I went through menopause, I was afraid to start hormones because of my mom having a history of breast cancer. And I think we're really starting to see a change in that fear of hormones, because historically there was a big fear back in the early 2000s because of the Women's Health Initiative study that basically said that there was an increased risk of breast cancer or increased risk of heart disease with hormones. But now they're looking at that study, and unfortunately, though, that fear has persisted this many years. But they're looking at that study, and it was the types of hormones that were being used in those studies that were the issue. Now, of course, I can't comment on your specific, case, and it's something you want to discuss with your doctor. But when we're talking about hormones, and I know, Dr. Anna, being in integrative and functional medicine like myself, we understand there's a difference between the non-bioidentical hormones that were created and sold and manufactured that we now know are incredibly inflammatory. And those are the ones that potentially, have that higher risk and make me nervous. I'm not politically correct. I'll just come out and say it. I think it's actually criminal that those hormones are still on the market. I really think it's terrible. And yet bioidentical hormones always get a bad rap. And I'm like, wait a minute, what's naturally occurring in our body is not the problem. And in fact, exactly, they can be protective against certain cancers. So, I think anything in balance is the key, because we do know that, women who tend to be obese are, and I know that's not a politically correct term, but lipose endowed, have a little extra, fat tissue on them, they will naturally have certain higher levels of certain estrogens and potentially have higher risks of uterine cancer. And that's their own natural hormone, but that's because it's not in balance. So bioidentical, bioequivalent natural hormones in balance are not a problem.
Exactly. But I've never seen that as a problem in my now 30 years of practicing medicine. It's the synthetic hormones that cause the problem, the history of synthetic hormones. So breast cancer and breast health, we want to create bodies that are inhospitable to cancer. And that's key. You guys, this is your opportunity to ask questions. Also note that I am giving away menopause success kits today. So I've got a lot of these to give away today, over $150 value. So be sure to follow me and Dr. Betsy Greenleaf. Tag a friend and share this message, and you are entered to win. So I want to encourage all of you guys to do that. So I'm looking to here at Instagram, and we've had a lot of questions come in. And so let's see, there's so much to talk about here. A lot of good questions. Food, Family, and Travel says such wonderful topic and advice. Thank you both. Christy said, what percentage of bladder leakage over what age again? 85% of women over age 65 experience incontinence for some duration.
Yeah, and unfortunately, the adult diaper industry is a multi-billion-dollar industry. And too many of us just chalk it up to like it's a natural part of aging. And just because something's common doesn't mean that it's normal and that you have to live with it. Because I've seen women who don't leave their houses. And we know that, to have total health, you need body, mind, spirit. And you can't have that spiritual, mental balance if you're not getting out and, interacting with other humans. And so I've seen women who literally just, sit in their house and are wasting their lives and because they're afraid to go out because they might pee themselves. And there's so many options for incontinence that you don't have to be homebound. So there are tons and tons. And when I tell you, when I first went in training, there was 2 medications maybe for overactive bladder, and now I can't keep track of them. And not even medications. It could be changing diet. It could be getting, balancing the gut microbiome with healthy foods. It could be strengthening your pelvic floor. And there's lovely pelvic floor physical therapists that can be, you can pretty much, they're starting to pop up all over the place.
I love them. They're some of my favorite people. Just game changing, in
Jolva,
they love Jolva. The pelvic floor therapists love Jolva. You see a transformation. You see the transformation. But other countries post childbirth, part of the community, part of the care, postpartum care is pelvic floor physical therapy. That's how important that is. You guys, I give you a lot of information at dranna.com, dranna.com. Betsy, tell them your website and also post in the comments the pelvic floor store so people can see your pelvic floor store, which has so many good solutions for people. So, Amy, awesome. Good that you're here sharing and tagging.
So we got the pelvicfloorstore.com and in fact, actually, I'll go after we're done and make a coupon for 10% off. It'll be Dr. Anna for 10% off.
So DRANNA at Pelvic Floor Store. Check out her goodies there. And she ships to Canada. You guys, she ships international to Canada. We've had our hands cuffed on what we can ship to Canada.
Should we be announcing that?
I know. Yeah. Sorry. Never mind. You guys didn't hear it here.
I heard a rumor that I might ship to Canada.
I heard a rumor. So anyway.
Yeah. And
Pelvic Floor Store, you guys.
Soon, it's not up yet, but coming soon will be the International Pause Institute.com.
Oh, the International what?
Pause Institute. So it's a center for perimenopause, menopause, andropause, so you can live your best life 40s forward. But I would say give me a follow on social media, because as we get closer to that, I'll be making some announcements. So yeah.
That is awesome. And here, let me post your pelvic floor store. It's so easy to find here. Pelvic Floor Store. So there we go, pelvicfloorstore.com. Use
Thank
code
you.
Dr. Anna, DRANNA, and you'll get a discount. She's got lots of good, and it's vetted very well, right? Like stuff you
Yes.
can
As soon as I
trust.
come, it'll be all capitals. So as soon as we get off of this, I will go make that code for 10% off. So yeah.
So thank you, Betsy. I know, gosh, everyone was so awesome on Instagram. We were going live and in and out, trying to make sure, we had technical difficulties. Well, this has worked so much better. This has worked so much better. So, food.
I'm glad that we'll have to do it another day, another time too. And even though today's only one day for World Menopause Day, every day is Menopause Day, and it's a day, to make your lives better, because menopause does not have to be our grandmother's menopause. This is our time to kick some butt. It's actually your best lives, it's your best years ahead of you.
Yeah, I agree. It's a time to open up, not to shut down. It's a time to really be in touch, get to know and love yourself and those around you, and really prioritize. I mean, so much good. There's so much good. So we'll keep sharing. And you guys, there was a question that came in too on our Instagram feed from Donna Terrell. She said, "Is the cooch ball a good idea?" I love the cooch ball.
I dug the
I
cooch ball,
love
and
the cooch ball.
I have to get that on my site. I haven't gotten it on there yet. And yes, the cooch ball is an amazing. If you guys have to go check that out, it's a great pelvic physical therapy device to strengthen. The other thing I love is Kegel exercisers, and I'm just gonna throw a plug in for. I like the +1 Kegel exerciser because it's super affordable. So that is one that, it's a little device that you put. Actually, I have one right here. If I have 2 seconds, I know Danny's going to be mad that I'm going in there.
Yeah, maybe we send Danny this link, Amira. So, it is showing up nicely on Instagram. You guys from Instagram, you're seeing this. You see us both together. Is that good video? Trying to figure this out. Is it better if I...
So there we go. I don't know if you still see me, but that is the Kegel exerciser from +1. I love it. Super affordable. I think you can find these in like Walmart and Target. I know they have it on my Amazon, and it's just like there's a little device that goes internally, and then there's one that has little lights to let you know that you're squeezing and doing it correctly. So really amazing product. So we also have it on the Pelvic Floor Store.
I love it. Thank you so much. All right. So we're going to hop off next and be joined by Danny Williamson. Thank you, Dr. Betsy Greenlee, for being here with me today. Love you, girl.
Bye.
Take care. God bless you. Bye-bye.